Can you introduce yourselves and tell us something about you?
I'm Matthew Barrett. I'm an orthopedic consultant specialising in shoulder and elbow surgery here in Dorchester. I've been a consultant for just over 3 years, and I've worked with Lima for the whole duration of that.
I'm Trevor Blackburn. I'm retired now, but I worked as a chartered surveyor in the construction industry all my life. But I was also, I still am actually, a level 5 LTA tennis coach. It's been involved in the game all my life. Now that my wife and I are both retired, we spend a lot of our time playing sport, travelling around.
How would you describe the pain in your shoulder to someone that's never experienced it? And what were the challenges in your daily life? What is the progress of such a disease?
I never had any serious pain on an ongoing basis. I couldn't say that I lived my life in pain, but there were so many tasks that I couldn't do. I couldn't reach up above shoulder level. If I turned over in bed onto the wrong shoulder, then I would wake up. And my wife always joked that she could hear bone on bone. Because I was loath to do anything about it, I wanted to be able to carry on as long as I could. It got to a point when it was really too difficult to carry on. I play a lot of tennis, so I couldn't put the ball up in the air. My golf swing was difficult, and that may sound trivial to a lot of people, but when you're retired and that's what you enjoy doing, it's very important. So it got to the point when I started making appointments, having x-rays and scans, and met Matthew, and it went on from there.
Yeah, well, I think we first met back in sort of early 2020, and yeah, as you say, pain isn't always the main symptom. It's the loss of function, and you'd obviously had this problem with your shoulder for quite a long time.
Yeah.
Your fear was that if you'd had a shoulder replacement, then you might not be able to play tennis.
Yeah.
But it got to the point where your function was so restricted that you sort of didn't have much choice, and it was clear from you examining you that you, as many patients with this problem do, that you sort of compensated, you'd found ways to get around it by using your shoulder slightly differently.
Yeah.
But the X-rays and then showed that you got very advanced arthritis, and probably the worst I'd seen really. So it was quite amazed that you were functioning as well as you were, given what the X-rays looked like.
Mr. Barrett, what was the right solution for Trevor in the end, according to the clinical case? And what were the expected outcomes?
After we'd sort of been through everything and Trevor's current function and his aspirations, we looked at the scans and talked about the options, and given the sort of severity of the arthritis in your shoulder and the wear, particularly at the back of your socket, the back half of your socket had gone really, and you'd formed almost a new socket, which made it very difficult or impossible for a standard shoulder replacement. So then we started looking down we're fortunate to have, in this day and age, custom shoulder replacements where, based on your CT, that we can sort of model, what we'd like the shoulder socket to look like, and we can perform a sort of 3D printed shoulder replacement. Whilst we're cautiously optimistic, we both agreed that it may not mean that you could go back to playing tennis at your level of sport. But I think we both felt that you're at the point where, we'd sort of tried everything we could with the injections and things, and you were prepared to sort of roll the dice and, remove your pain and hopefully get back to your activities.
Yeah. And so when I met Matthew, I obviously respected his advice. I trusted him. He said that this was really my only option. It was that or risk being able to do nothing at all. And so once he explained that, I became very keen to press on as soon as possible. I'm an optimistic person. I trusted his advice, and it turned out to be excellent advice.
Can you tell us how you prepared for the surgery?
Well, once I'd had my meetings with Matt and we'd agreed what he was going to do, I put myself in his hands. But I just trusted him to get on with it. It was nothing I could do. I just had to turn up on the day, be put to sleep, and wake up with a new shoulder. So that's really what I did. I really didn't worry about it very much.
Yes, from my point of view, after we'd been through everything, it was the ProMade service makes it very straightforward. So the CT scan of Trevor's shoulder was sent off. A dedicated engineer sort of modelled what based on what I'd detailed and what I'd like. a couple of online meetings, going through the design, a few tweaks, and sort of reassurances that I'd be able to sort of safety check it each step of the way.
What improvements did you first notice after the surgery?
Physio and so on is quite slow, and you have a sling on and so on and so forth. I mean, I took the sling off as often as I could. I did my physio, and so that went fairly smoothly. Within 9 weeks of surgery, my wife and I went on a month-long golf holiday in the camper van. We played a lot of competitions all over the country, and my swing was about 3 inches back and 3 inches forward to begin with, but by the end it was pretty well back to where a 70-year-old's golf swing can be, and so that was tremendous improvement and something I hadn't been able to really do pre-op. Tennis was a big part of our lives. I'd gone from fearing that maybe I wouldn't be able to do that to finding that not only could I do it, but I could do it better or pain-free.
Mr. Barrett, to conclude from your perspective, how is new technology transforming orthopedics today?
Yeah, I think we're very fortunate to in the sort of current era of orthopedics to have this technology available. As with sort of Trevor's case and his severe wear, then and previously surgery may not have been as obvious an option or as successful. And as I sort of said earlier, that a standard shoulder replacement I'd have been very concerned wouldn't have been appropriate. So it may have meant that that Trevor had undergone a couple of operations to firstly to sort of restore what was missing, and then perform a shoulder replacement, which is it's not ideal having two when you can have one. And there's 3D sort of printing and modelling that we can now do, and allowing sort of custom made implants has really sort of revolutionised dealing with the more complex patients. And I think as with the recent crises and the COVID pandemic, there's a lot of patients that have got a lot of deformity there's been delays for everybody. So having that option when needed, certainly not for everyone, but for those special cases, it sort of takes the pressure off and means that I can say with more certainty to these patients, this is a bad case, but there is an option, and it's all very straightforward.
What distinguishes ProMade from other surgical options?
It's very easy in that you're part of a team straight away, and even though it's all sort of done remotely, that you've got a dedicated sort of engineer and a sort of case officer that that I had complete control of the whole process, but whilst with their expertise and input, so I could get exactly what I wanted, knowing that what I wanted to achieve at the time of surgery, and they were able to help me achieve that. And the nice thing about ProMade is that on the sort of the day of surgery, you get a series of models that you can check each stage of the way that it is going to fit, before you take that sort of so-called leap of faith. So it's all very straightforward and very easy to use.
And finally, what's it like working with LimaCorporate?
I think they were an excellent company to work for. There's a clear sense of passion in the company, their desire to improve what we can offer to patients from an orthopedic point of view, and the technology is driving it, but it's also remains sort of patient focused. So I think it's good for me, and it's good for patients like Trevor.
In conclusion, what would you say to each other?
I'd say, well, firstly, well done, Trevor. I think your sort of engagement and hard work has paid dividends. Thank you for being such a good patient. It's been a pleasure sort of working with you, and I hope you continue to enjoy your shoulder replacement and any chance of helping me with my serve.
Well, first of all, I've got to say thank you to Matthew, because without him I wouldn't have the shoulder that I've got. And thank you to Lima as well, because I didn't know Lima, but Matthew obviously works with you a lot, and so everything for me has worked out really well. I'm able to live a normal life. I can lift my arm above my shoulder, which I couldn't do. I can even cut hedges and screw things up on shelves on the wall. It's painful, but if you don't do it, you won't get the result. So thank you to Matthew, and thank you to Lima.